My name is Toni Rose Mieses. Thank you for joining my channel today. And I'm excited to talk about a topic that I'm extremely passionate about, and that is clinical leadership in mental health treatment. Today, I want to talk a little bit about what it is, why it's important for us as a field, and also share a little bit about my story and my background in the context of clinical leadership training. So let's begin by just jumping into it. Clinical leadership in the mental health field is a combination of three different types of theory of practice coming together to create a unique skill set that is extremely helpful for creating effective mental health programming. The first skill set is, of course, clinical expertise. So this is the knowledge, awareness, skill of being able to understand and implement, whether it's through direct practice or through theory, mental health interventions. Clinical expertise is the knowledge of diagnosing, creating treatment plans, thinking about cultural competency and humility in the work, being able to know about evidence-based practices and which evidence-based practices may be helpful for different types of people. It's about knowing your toolbox and the skill set needed to be able to work with anyone who comes in front of you, being flexible, and of course, knowing those core foundational skills, no matter what practice you're using, of being an effective counselor. Empathy, reflective listening, double-sided reflections, all of those core clinical components that are important when in a room with a client or clients. Clinical expertise is an essential function of mental health programming. And while it is foundational to have this skill set in a management role, in a leadership role, it only takes you so far. And so the additional components of leadership and management, which we'll talk about the distinction between the two, help take you from being an excellent practitioner or even supervisor to a strategic planner for a long-term successful program full of happy staff and clients, which is extremely important. So that takes us to the next one, leadership. So leadership is the vision. It's the plan. It's being able to work and develop and create highly effective teams. It's being able to navigate through difficult conversations and situations to inspire those to keep going, to give it a try, to trust you, to trust the process. In mental health settings, a clinical leader is someone who can say, hey, clinician, I know this is new. I know I'm asking you to do a new intervention. Supervisor, I know I'm asking you to reach a KPI or a high expectation, because we do have high expectations to meet best practice for our clients. And so how do we get someone from this big vision, right, of trying to make community level impact or impact with a certain population or a group of people through our mental health skills? Well, that requires a leader, someone to trust, someone to inspire, someone to help you see the big picture when it's hard to do so. And more importantly, helps you then develop those skill sets as well, right? Trust yourself, become a visionary yourself. And so the leadership aspect of clinical leadership in mental health is really around knowing what type of leadership styles are helpful, how to select teams in the context of mental health, how to know about your own skill set and your own limitations to then surround yourself with the people who can help take a vision or your organization's vision to the place that it needs to be. And so leadership is a core component of that. Now, the flip side of the vision are the details. And that is where management comes in. Now, I don't know about you, but I also feel like sometimes the rhetoric around leadership and management are at odds, right? Don't be the manager, be the leader. Well, I'm here to tell you that just from personal experience, and the research supports this, is that you actually need both. And they're actually unique skill sets. Being able to create a strategic plan and a vision and instill trust and hope in a team of people, especially a large group of people who may be under you, is also different than overseeing policy, procedure, day to day operations, knowing if you're hitting your mark or not, how to talk about data, how to track data. All these aspects are all part of the management hat and are extremely important for clinical service delivery. And so, as you put all these three things together, clinical expertise, leadership, and management, you start to see that some of our background in programming, I come from a master's in mental health counseling, don't always put all those three things together for you. And so we're going to talk a little bit about then why it's important to develop this particular avenue of skill set for mental health practitioners who are interested in becoming directors, assistant directors, group practice owners, anything that requires a bigger vision and how to get there. And so let's talk about why it's important to build this part of the field. So the concept of clinical leadership in general is not new. In fact, in the healthcare settings, physical healthcare settings, this is a term that you often see in some programs, particularly in nursing, as an example, or business administration, where they talk about how to combine these different skill sets to run effective healthcare. And yet, it's interesting to see how this still needs to be developed in the mental health space. And it's important because we know that though mental health is a part of the physical health domain, we also know that mental health has its own set of unique challenges like stigma, billing, the way that we provide care. All these different elements make the need for clinical expertise, particularly in the mental health space, in combination with leadership and management, extremely important. So let's talk a little bit more about the why. So one thing that I've noticed in my career and over the last few years is that mental health practitioners are being asked to do more in more spaces. So we're being asked to start programming in spaces like alternative for policing, more mental health in different systems like child welfare, which I have my own background in. We are being asked to use a very valuable and important skill set and really impacting societal change. And we often do this by implementing programs within these pockets, right? As I just mentioned, right? Child welfare. We talked about like policing, alternatives to policing. I know you probably have heard, or some people have called for more social workers to address complex issues like homelessness. And so these are just a few examples of how mental health practitioners are being asked to address societal issues. And I want to be clear, our skill set is incredibly valuable in making this level of societal impact. On the flip side, though, is sometimes these different systems aren't necessarily ready or set in conditions that allow for a mental health practitioner to do the work as it's to be done, right? So, for example, if you know anything about systems level thinking, it's really hard to kind of fit a circle into a square. And so, for example, if you are looking to, let's say, implement a mental health program that the ultimate goal is to, let's say, reduce homelessness, which is an incredibly important goal, we need people as intermediaries in between those goals that know how, one, what's the clinical knowledge set and intervention that's needed to get from a direct clinical conversation to this big societal change, right, or this community level change. We also need leaders who are then able to create a pathway, right? That's the strategic plan. Create a pathway to get from one session, right? Sessions at individual level to reducing community level homelessness. And then we also need someone with the skill set to manage the day to day operations of all of those things. And as you can imagine, once you start putting it into the context of what mental health practitioners are being asked to do, you can see that there's a lot of different skills at play, and it can become extremely overwhelming for new mental health leaders who are trying to get this skill set at the same time as they're trying to do this work. And even if you want to put, let's say, community level um, change to the side, right? Say if you are wanting to open a group practice, right? We're seeing a lot of mental health practitioners shift into more private practice space and more of an entrepreneurial space, which has always been there, and we're continuing to see that grow. It's a very different skill set to supervise a team of therapists versus running a group practice where you're maybe supervising supervisors now. And that direct level of influence on the clinical work is starting to expand. And then on top of that, you have a business plan, your own business strategic plan on how you want to navigate the change in your mission and values. And so, how do you run an effective team of clinicians or a program while ensuring that the clinical outcomes are there, and then also that your staff are happy? So this is where you're starting to see a little bit of the clinical leadership and mental health gap and how this skill set can be extremely valuable in trying to put these pieces of the puzzle together. One additional factor that we want to consider around why this is important is as much as clinical outcomes for the people that we're serving are important, our staff, the mental health practitioners that we're hiring, that are doing the direct intervention, are equally as important. And yet, what we're seeing is the highest level of burnout amongst mental health practitioners. Um, and we're also seeing that in combination with mental health practitioners trying to, figure out how they fit into this system. And so we're experiencing burnout with our mental health professionals. And it's really important as leaders in the clinical mental health setting to really figure out how to create successful programs that lead teams and mental health practitioners to feel, to not only feel, but also be competent enough to do this work, right? And so, one thing to think about in terms of the why is a clinical leader who has background in direct clinical work, but is also a strategic planner, It's going to think about core things like what is an ideal caseload for someone working in a high stress environment, right? Which is a huge reason why clinicians are being burnt out. Um, it could also look like, when you're trying to set up programming and you're working with your organization or with a contract to figure out what that's going to look like, someone with the skill set is going to say, we're not going to be able to afford high quality clinicians with this budget. Or we know that clinicians are going to need additional funds for continuing education and training. And so these are the unique aspects of the role of a clinical leadership that display why someone needs all three things um, to think about when creating mental health programming, right? And so you can tell that as a community, a society, we are looking to expand how we can use this valuable skill set in different settings. But as we do that, we also want to skill up that director programming level role with these three components, right? And so if we don't do that, the risk is we are going to be implementing programs in a space where we don't have people who are at the wheel who can really drive um, change in a way that is sustainable for clients and staff, which is always what we want. So a little bit about my own story. So my master's is in mental health counseling. I very much enjoyed my program. I felt like it gave me so many important skills around doing direct practice. And then I also had the privilege of coming into an organization fresh out of grad school that implemented evidence based work. The reason why that's important is because right from the gate, even as a green, brand new therapist, I was surrounded by training and consultation and peer support and organizational support that was geared towards the mission of supporting me and being able to support my clients and the families that I worked with. And the reason why that's important is because we always want to be able to manage that risk of supporting new clinicians and allowing them the space to learn, right? That's the leadership trust piece, while also ensuring that we're surrounding them with the supports so that way the families or the clients that are being served are not then being disserviced, right? So you're always managing those two skill sets, right? A new clinician being able to learn, a family or client being able to get the best care. And so as I worked my way up into different roles, for example, when I became a supervisor, I did not get the same amount of training, but going back to the strength of the organization that I worked in, I was able to still get a good amount of training, right? And so I was trained on how to be a supervisor in that particular model. I was, also given leadership training and supervisor training. And so still, as I'm moving up, I'm getting this kind of wraparound services and support to be able to be successful as a new supervisor, learn, but also support my now team who's doing this work, right? When I became a director, the initial training, consultation, all of those pieces no longer existed. And it wasn't to the discredit. This isn't to the discredit of the organization. In fact, this is what many organizations face when they're promoting from within or trying to create new mental health programming, is that this type of integration of skill sets of clinical leadership and mental health isn't packaged or researched in the same way. And so, myself, like many leaders who are program directors, are doing this piecemeal, right? You're taking a leadership class over here, you're taking a management class over here, you're trying to figure out the clinical piece, you're trying to understand policy, you're trying to figure out, how to utilize data, how to build an effective team. And while this kind of personal grit that comes with many mental health practitioners is really important, it also speaks to a knowledge gap that we have as a system, and the importance of needing foundational training or knowledge. So that way, thinking about again that balance of being able to learn while still having supports for the people who are underneath us, um, by having a training that speaks to these three different components, allows for that level of training and support and learning. In addition to that, I also have a background in international psychology. I'm finishing my PhD with a specialization in organization and systems. And so, as I'm doing my own research and looking at successful programming internationally, you're seeing this integration of these three different components. Is what really kind of brings successful programming together. That is the thread, cross culturally, cross globally, cross programs, is when you have a strong clinical mental health leader, someone who's able to combine those three things, you're seeing that you're able to create successful programs that have happy staff, that have staff who want to grow their own leadership skills, and continue to support their clients. And so that's part of the reason why I created the training. I wanted to pull from my experience and my education to create a hands on approach to learning how to plan for the big picture, strategically plan, thinking about all the different aspects of mental health programming, all the way down to how do you want to oversee and manage it, how do you want to utilize data, to the interpersonal aspects, right? How to coach staff, how to take the temperature of staff and their happiness and their well being, all the way down to, of course, client outcomes and making sure that they're also having the best care. In summary, clinical leadership in mental health is just a combination of three important skill sets: clinical expertise in the mental health field, leadership theory, and management skills. And combining these three skill sets can allow for happy employees, sustainable programs, and of course, the best care for the clients that we serve. It's clear why we need it, as we are being asked to step into spaces and really use our very valuable approaches to change that are empathetic and caring. We also need people at the reins who understand this work and can create a program that people want to work in and clients want to remain a part of. And I hope that by sharing my story and my origin on how I created this training, can really help those who are interested in getting into management roles and wanting to lead successful mental health teams and programming can really help you on your journey of being that person to inspire in a setting where we really need leaders. And so thank you for your time. I You can continue to subscribe and like my channel. I'm going to apply and then create more videos to explain the different aspects that go into this role. So hopefully if you subscribe and you're interested in this content, you can learn more about the different aspects. In addition, you can learn more about my training at my website, which is www.tonirosemieses.com. I'm going to provide the link below. And yeah, I hope you can learn more and this inspires you to be the clinical leader in your community.